Good afternoon, guys. So today I would like to talk to you guys a little bit about PAD and human euthanasia. Raise your hands. How many of you guys actually know what PAD or human euthanasia is? Okay, so for those of you that don't know, PAD is physician-assisted death. It is when a physician prescribes a medication to a patient that has a lethal dosage with the intent to kill that patient if the patient decides to take the drug. Now, human euthanasia, on the other hand, is when a physician administers a drug physically to the patient that has a lethal dosage with the intent to kill them as well. Now, I understand that might raise some alarms amongst some of you if you don't know a whole lot about the subject, but give me a chance. I'm going to explain it a little bit to you and as to why I think it's morally right for a physician to be able to provide these things to a patient. And hopefully by the end of this, I've convinced you that it's morally right too. And if I haven't, hopefully I've at least given you a little more information as to what PAD is. So if you ever have to cross it for whatever reason in your lifetime, you can make a more informed decision about it, right? All right, so I believe it's morally wrong as a physician to not be able to provide this information, because as a physician, it is your job to provide the best care, the best comfort, and all the information you can to the patient about what their illness is and what you can do to help treat that. PAD is a way to treat that. Now, I also believe that PAD should be used as a last resort and a last resort only. And the reason I think that is because as a physician, you should educate your patient on all the avenues of approach they can take to getting a somewhat normal life back. And then if the patient decides they want a different approach, you might be able to suggest PAD to them. You don't want to suggest it first because it might pressure them into taking it and then not giving them the chance to think of ways they can have a normal life again, right? All right, so there was actually a study done by Blandon and a few people at a hospital that was a survey of the public opinion of PAD. So if you go back to the 1950s, their study showed that only 34% of people thought PAD was morally acceptable. Then as time went on, in the 1970s, 53% of people thought it was acceptable. And then in the 1990s, 63% of people thought it was acceptable. So that shows you that the trend as time goes on, that more and more people in the public are starting to think that PAD is morally acceptable. And then there was a second study, which is on the right-hand side of the screen. It was done by Seattle Cancer Care Alliance. Now, Seattle Cancer Care Alliance did a survey of 114 terminally ill patients on why they were requesting information about PAD. So you see the first bar graph, the biggest one, it was 98.7% of the 114 people were asking about information of PAD because of loss of autonomy. And then 88% of those people out of that 114 were asking about information of PAD because of the inability to engage in activities that they once enjoyed. And then 75% of those patients were asking about PAD because of loss of dignity. So you can see that PAD information being requested by patients isn't more so based on physical aspects like pain and treatments. It's more based on psychosocial aspects, things that are going on in their mind. So that's why it's such a moral subject. Now, some counter arguments to my argument would be, surprisingly, from the medical field. So oncologists are people who work with cancer patients, so they're very familiar with terminally ill patients. Now, they believe that patients should be provided the best care, the best comfort, and all the available options to treating their illness, because in today's technology there are so many avenues of approach you can take to treating like cancer or an illness or any other terminally ill disease that a patient might have. Now, my counter to them would be, you can't think of it as specifically a medical provider, because what if that person doesn't have medical insurance? What if that family doesn't have medical insurance? How are they going to be able to provide the money to pay for these costs? Because we all know the medical field costs a lot of money, especially when it comes to treatments for cancer and chemotherapy and stuff like that, right? So it would be hard to tell that, it would be hard for the family to pay for all those. It would be hard to provide that care if you can't pay for it, right? All right, so another issue would be the legality behind it. So there's actually right now only 8 states that provide the option of PAD to physicians. And they do that, and only 8 states so far provided, because it is hard in court to prove that someone was terminally ill and that if the physician prescribed PAD to them. And it's hard because there is no law that gives a clear definition of what terminally ill is. It's hard, what one doctor might say is terminally ill, another doctor might say is not terminally ill, and that the patient has a way to cure them. And if they decide to go with the doctor who thinks that the patient isn't terminally ill, then the other doctor who did PAD for that patient now committed homicide, right? So you can see how it's a very big moral issue. Now, I don't want you guys to think of this as if it's happening to someone else. I want you guys to think of your family member, your brother, your sister, your mother, your father, etc. Think of them as if they were terminally ill. One, do you think you would be able to cover the cost for that treatment if they were to have it? And then two, if your family member told you they were considering PAD, and do you think you would have the heart to tell them, no, they cannot pursue that? I understand that you might ask them about why they're doing it and give them options and try to convince them not to. But do you think at the end of the day, if they said they're going through with this, you could tell them, no, they cannot do it? Just think about it. Thank you.